Dr. Deepti Nair, Senior Consultant Pediatrician and Neonatologist at Rainbow Children's Hospital, Sarjapur Road, Bangalore. So children coming in with constipation is not uncommon these days, especially with less intake of fiber-rich food and easy access to junk food. We do see commonly in babies when they started on weaning food and not given adequate water. Around the age of 1 year, when cow milk is introduced into their diet, and toddlers where they are very busy and they keep postponing the bowel movement while they are playing. So the presentation could be different. Some kids might be having infrequent stooling of less than 3 times a week, or they could be passing hard pellet-like stools or large stools which could be painful, or sometimes it could be blood streaking in the stools. So when it starts hurting the child tends to hold the stools and would refuse to pass the bowel movement, would refuse to go to the washroom. Toddlers can be seen hiding behind the curtains or going to some corner of the room, standing there, trying hard not to pass the stool. So what happens when the child holds and doesn't pass the stool? As the stools stay in the colon, as the days go by, more and more water gets absorbed from the stools become harder, and also the smooth muscles of the intestine get stretched and the bowel movements become ineffective. So much so that the child after a few days might not even have the sensation to have a bowel movement. Also, the liquid stools and the soft stools might leak through the sides of this hard stool plug, and the child can have soiling of their undergarments unknowingly. Now, this loaded rectum can also have pressure effect on the urinary bladder, preventing the complete emptying of the bladder, and that could cause a urinary infection to the child. So how to prevent constipation? My advice to the parents would be to increase the water and fluid intake for the child, to increase the fiber intake to the child. That would include good serving of fruits, vegetables and pulses. Come down on the junk and the refined food as much as possible. Come down on the milk intake to just around 400 ml or max 500 ml in a day. Make sure that the child is encouraged to have more and more of physical activity rather than glued to a gadget. At the age of 2, it's better to start potty training. Encourage the child to sit within half an hour of a major meal for around 10 minutes. Post-meal, there is a gastrocolic reflex which we utilize to regularize the bowel habit, and try it at least twice a day. So when these symptoms go on for more than a month, it is better to consult your pediatrician, who would be prescribing some stool softener according to the symptoms, the dosage according to the symptoms of the child. And do continue the stool softener till the child starts passing soft stools. Most importantly, till the child loses the fear of passing the stool. And once that happens, we would suggest to slowly taper the dosage over the next few months. Please don't abruptly stop the stool softener, because that could cause the symptoms to recur. As a parent, the best thing that you can do would be to make sure that your child doesn't skip a single day without a bowel movement. Thank you.